are one nation, one people. When called upon to give from within, we come together and find that our capacity to help others is limitless. Here, we are fearless. What lies inside all of us is more than data. It's life. It's more than insight and medical research. It's vision and honor and compassion. What's flowing through America's veins is its diversity. The next great breakthrough will be found in each and every one of us. And what we find there will unlock mysteries, heal the sick, and eradicate disease. We ask for 1 million individuals to come forward and stand on this landmark in history. We ask America to do, once again, what she has always done: lead the way forward. We're one nation, one people, but all of us are different, and it's those very differences that will lead to answers for generations to come.
Good afternoon, everybody. Welcome to the All of Us Research Program launch event. For those of you who don't know me, I'm Leland Statham, Senior Meteorologist with the News Channel 5 Network. I'm so excited you have chosen to be a part of this historic day. The future of health begins with each one of you, and today we learn about a research program that is seeking to accelerate health, research, and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. As I look around here at Madison Station, I see diversity in so many forms. What is diversity? It is your uniqueness as an individual, along with your lifestyle, the environment in which you live, and your biology. We all come from different walks of life, and it is recognizing and appreciating that diversity that is the heart of the All of Us Research Program. For the next hour, we will hear from leaders at the National Institute of Health and key members of our community here in Nashville, and the importance of this research program and the promise that it holds. To get things started, we're going to go live here in just a second to New York City with NBC News medical correspondent Dr. John Torres. I'll see you in a moment.
Engagement Officer of the All of Us Research Program, Dr. Dara Richardson-Heron. Okay, there's an amazing lineup of speakers and activities taking place around the country today. To celebrate the launch of the All of Us Research Program, if you're watching at home, I welcome you to join the conversation at #JoinAllOfUs. That's #JoinAllOfUs. Now, I have the pleasure of introducing the very first speaker, Dr. Dara Richardson-Heron. Dr. Richardson-Heron is the All of Us Research Program's Chief Engagement Officer. She's a physician by trade and an advocate by choice. Dr. Richardson-Heron leads the program's outreach efforts to enroll and retain those 1 million volunteers with a special focus on populations that have historically been underrepresented in research. Dr. Richardson-Heron, thank you. Appreciate it.
Thank you so much, and greetings. I am Dr. Dara Richardson-Heron, and I am the Chief Engagement Officer for the All of Us Research Program. I first want to extend my heartfelt thanks and appreciation to everyone for participating in today's celebration, marking the formal and official launch of this exciting new research effort. We certainly hope that through today's activities, you will walk away both informed about the All of Us Research Program and, most importantly, excited to participate. The All of Us Research Program's goal is to bring together 1 million or more volunteers across the United States to donate health information for research. And among many other things, researchers may be able to use the information we collect to identify steps that we can all take to stay healthy much longer, to help us find better health conditions early and more often when they're most treatable, to better understand why different people respond differently to various medications and treatments, and also to develop more effective, personalized, and precise treatments that are based upon each of us as unique individuals. You know, our mission is simple, but bold: to accelerate research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. And certainly, as someone who's been fortunate enough to have the opportunity to be part of this program from its early days, first as an advisor and now as a member of the All of Us team, it has truly been amazing to see how much progress has been made so far. But you know what? Even more importantly, as a physician, as an advocate, and as a 21-year and counting breast cancer survivor, I am both hopeful and enthusiastic about the progress yet to be made. You know, over the past few months, our team has built the infrastructure, developed a website, tested systems, and brought together a great team across the nation. But today is when we add the real heart and soul to the program. Indeed, today is when we officially open our doors to invite everyone to join us. And with your help, we hope to transform the future of health. We hope to move from a time when healthcare is largely focused on treatment of chronic diseases to a time when we are shifting our focus more towards prevention. Imagine that for a moment. Imagine a future where illnesses can be prevented and the burden of disease minimized. Imagine a world where everyone participates in the development of new discoveries and therapies, and everyone benefits. You know, an enormous amount of teamwork, dedication, determination, and passion has gone into bringing this day to fruition. And our continued success will only be possible through the continued cultivation and nurturing of valuable partnerships we forge with people, communities, and organizations across the country. And we are just getting started. And to be clear, our mission is not just to find 1 million or more people to volunteer and share medical information with the program. Our mission is to find 1 million or more people who reflect the rich diversity of our nation, who will not only participate in the program, but also partner with us and help us create an opportunity to change health and healthcare for the benefit of everyone. And we're seeking adults of all ages, races, ethnicities, sexual orientations, socioeconomic, and health statuses to join us in this unprecedented effort. And we're seeking people from every corner of the United States, because we know all too well that where a person lives has the potential to have an enormous impact on their overall health. We must make sure that all communities are well represented in our program, particularly those who have been historically underrepresented in biomedical research, so that everyone has the opportunity to benefit from any new scientific discoveries and treatments. You know, one of the greatest things about this country is its rich diversity. And it's that diversity that the All of Us research program hopes to harness to help us learn more about and hopefully change the unfortunate reality that there are many communities that have a significantly higher disease burden than others. You know, health disparities are well known, but not at all well understood. And research has the potential to be a powerful change agent in that regard. But, you know, as exciting and promising as our research program truly is, we know that participation in research is not a simple decision for everyone. In fact, we know that many people are skeptical and even hesitant to participate in research, and with good reason. There have been unspeakable instances where unethical testing and research was performed, often under the guise of quote-unquote medical treatment. And in other cases, whole communities have simply not been invited to participate in research. But our program is different. And we are not shying away from these issues, but rather we are engaging and partnering directly with key stakeholders, trusted community, and provider organizations and participant partners. We are fully acknowledging and addressing their concerns head on because we must. The stakes are just too high not to. And we're also collaborating with our participant partners to build a program with policies and processes in place to make sure that the transgressions of the past are never, ever repeated. And when I say participant partners, I mean it. The All of Us research program is unique in this regard. One of our core values is to make sure that participants help to co-design the program with us because we know for sure that the outcome and the impact will be significantly enhanced by their presence. So now that you're all super excited about our program, I hope you will go to our website, joinallofus.org, to learn more. And please consider joining our program because the only way we can improve health and health care for everyone is by making sure that research and research participations reflect the rich diversity of our nation. And you know, at the beginning of my remarks, I mentioned that a lot of teamwork, dedication, determination, and passion has contributed to making this day a reality. Well, certainly no one knows that to be more true than Dr. Francis Collins, an outstanding physician, an awesome leader, who has served as director of the National Institutes of Health since 2009, and he has dedicated his life to advancing scientific discovery to improve health. Dr. Collins has been a staunch advocate and champion for precision medicine for many years, and he is absolutely determined to make it a reality. That's because he knows the great potential that it has, the potential to transform and significantly enhance the future of health and healthcare for all of us. Please join me in welcoming Dr. Francis Collins. Thank you.
Well, thank you, Dara, for that very kind introduction, and greetings to everyone. I'm taking part today in the opening of the All of Us research program with our partners here in New York in the historic Abyssinian Baptist Church. If all of us can make it here, we can make it anywhere. But this is a simulcast, so no matter where you're located right now, whether you're in Pasco, Washington, Nashville, Tennessee, Birmingham, Alabama, Detroit, Michigan, Chicago, Illinois, Kansas City, Missouri, or someplace else watching online, we're all united by a common goal, building an amazing research resource that will make possible the next great discoveries in health and medicine. Let me start by saying that the All of Us research program is really about all of you and the power we together can bring as a nation of volunteers, curiosity seekers, health advocates, and innovators. So you'll be hearing from many different voices today about the huge impact this program can have for all of us, whether we're living with an illness or whether we're healthy and trying to stay that way. For my part, I want to share with you why this program will be so important for medical research. The National Institutes of Health, NIH, is the largest funder of medical research in the world. Our goal is to support medical research all over this country to understand how life works and how to prevent, treat, and cure illness. I've been involved in medical research for a long time, initially as a physician scientist supported by NIH, then as a leader of the Human Genome Project, and now as the proud director of this noble institution. So I speak with some knowledge and experience when I say that All of Us is one of the most ambitious research efforts that our nation has ever undertaken. More than almost anything we've ever done, this program has the potential to shed new light on how to manage disease and keep people healthy. I know that's a bold statement, but I truly believe that this program will be a game changer for medical research and ultimately for human health. And we're inviting you to be part of this national adventure. Just 2 weeks ago, we mark the 15th anniversary of the successful completion of the International Human Genome Project. That landmark effort to read out the 3 billion letters in the Human DNA Instruction Book has given us new insights into what makes each of us unique, from the color of our hair and eyes to the risks we have for cancer, heart disease, and many other illnesses. Back when I was leading that project, I thought to myself, what if we were to look at the genetics of many people, hundreds of thousands, maybe even 1 million, and combine that with other information about them, their environmental exposures, their diet and exercise habits, and their health history. Looking at all those factors would allow us to create a priceless resource that would speed up the research needed to deliver health care more precisely to each individual. No more one-size-fits-all, but optimized for each particular person. That's a concept we now call precision medicine. But if we really want to know about the factors that contribute to health and disease, we need to involve all communities. That hasn't always happened. So we have some big holes in our current understanding of health disparities, why some people are at higher risk of illness and even have shorter life expectancies. We can and we will do better, thanks to all of us. We already know that research that follows a group of people for a long time can help to identify risk factors that contribute to disease, information that can be used to develop better ways to prevent and treat the disease. The Framingham Heart Study, heard of that? Maybe the most famous instance of this type of study. Starting way back in 1948, researchers have followed several thousand residents of Framingham, Massachusetts for decades. And from the information gathered from these generous volunteers, they discovered that smoking, cholesterol, and high blood pressure are major risk factors for heart attacks and stroke. Believe it or not, before this, we didn't know those things, and many people thought that heart disease was just an inevitable part of aging. The knowledge gained from Framingham resulted in prevention and treatment measures that have saved many, many lives across the country. All of us will be 40 times larger than Framingham. It will study all diseases, yes, cardiovascular disease, but everything else too. And it will use a host of new and powerful technologies, and it will enroll a much more diverse group of participants. All of us will make the process of conducting research faster, easier, and less expensive. Imagine the power of 1 million people from all walks of life, all contributing thousands of pieces of information about their health, their environment, their genes, their lifestyle. These millions of data points will add up to one of the most powerful health research resources that we have ever had. And as a participant, as I am, because I signed up this morning, you will have access to all of the information that has been derived about you, giving you a chance to learn a lot about your own health. Importantly, all of this will be done with rigorous security protections and data access policies in place. Other speakers will share more details, but rest assured that your privacy and the security of your data is a priority for all of us. In addition to being a broad resource for traditional academic researchers, all of us will also provide opportunities for citizen scientists to ask questions. That will enable us to bring even more brain power to each problem, paving the way for the next generation of biomedical breakthroughs. So this is the first exciting step in a very long journey to understand the health of 1 million people over their lifetime. The bottom line is that I think all of us is tremendously exciting and innovative, and I hope each of you who are listening will join us in this new national adventure, whether as a participant or a researcher, or maybe both. Now, as you can imagine, a research program involving 1 million people is extraordinarily complex. It takes an incredibly talented, devoted team to make it happen, and the person leading this team is Eric Dishman. I hired Eric away from Intel to run this program for NIH, and man, does he know how to run it. We knew Eric would be great because of his leadership skills, his experience as a highly respected Silicon Valley executive. But what really makes Eric perfect is his personal dedication to bringing precision medicine to everyone. So without further ado, please join me in welcoming Eric Dishman, Director of the All of Us Research Program, coming to you now from Detroit, Michigan.
Well, thank you, Francis. And I got to tell you, with that introduction, we should hold national launches more often. I want to thank all of you here on Ford Field in Detroit. Go Lions! Woohoo! And I want to thank everybody across the country for joining us today. And this is my topic. That's what I want to talk about, and that's my hope. All of you joining us to take our first small steps together to create one of the most important research programs in human history. This has just never been done like this before. And while, yes, I am the leader of this effort, I am really here as a patient. I am here as a patient advocate. I am here as a family caregiver, and I am proud to say also a participant in the All of Us research program. Now, I should tell you that I am alive today because I was lucky enough to be one of the early prototype patients saved by precision medicine. At 19, I was diagnosed with a rare form of kidney cancer and told I would be dead within 9 months. Now, thankfully, they were wrong, but I did spend the next 23 years battling this misbehaving cancer, enduring more than 50 rounds of well-intentioned chemotherapy, radiation, immunotherapy, that we later discovered was destined never to have even worked on me. Now, I was eventually running out of options, and a colleague of mine helped me get access to whole genome sequencing and to get my complete electronic health record together. And armed with this new data, my doctors were able to understand my unique cancer and find me a treatment that was for me. So finally, I was cancer-free and eligible for a kidney transplant, and I am healthier standing before you today at age 50 than I was at 19. That's the power. That's the power of precision medicine. But the sad truth is, stories like mine are still very rare. Precision medicine is in its early days. Far too many people are still getting trial and error treatments for most conditions and diseases that are based on the average patient, based on research studies of people who may or may not be like them at all. But none of us are average. We need a healthcare system that responds to our uniqueness. To achieve this kind of individualized care, we need more data, we need more scientific evidence, we need more and different people. That's what joining the All of Us research program is about, being part of the power of 1 million diverse people coming together from across the country to create a future where my story is not so rare, and you too have treatments designed for a unique you. So why join this? A lot of people will ask me that. And I'm like, look, while participants so far have described so many different motives and reasons for joining, there are two themes that I hear from almost everybody: giving back and getting back. We all today benefit from the volunteerism of past research participants who gave of their time, their information, their surveys, their samples to make us, complete strangers today, healthier. So for many of us who have already signed up, we want to give back, or I suppose give forward, to future patients in need. I mean, I watched as arthritis crippled my grandmother, stealing away her ability to make these amazing chicken and dumplings that she loved to serve to us. And I watched Alzheimer's steal away my other grandmother completely. I saw my dad forced to retire early due to heart attacks and the surgeries that he had to go through, and I have witnessed more than 1,000 cancer patients suffering side effects and too often losing the battles against just these unrelenting tumors. Donating to the future of health seems the least that I can do. But let's understand, research breakthroughs can take years, even decades, for the data and the science to build up. Meanwhile, many participants are eager to get back their own health information. And we in the All of Us research program believe it is your right, it is your choice to get information and data back about your own health. I have been part of so many clinical trials and studies as a cancer patient where everything that I gave to them went into a black hole. But with All of Us, we're developing systems to give you access to all of your health information, including any health records that we collect. If you're invited to donate blood, you can get your genetic information back to learn about your family traits, ancestry, risk factors, and how you might respond to different medicines. When we're ready to run lab tests, you might want information back that's going to help you understand your environmental exposures from different places that you have lived and worked. And you will have the opportunity to see what researchers are doing with All of Us data and to find out what they've learned over time. Now look, I totally understand this. Choosing to participate in a study like this is and should be a very personal decision, especially to make a commitment to stay with us for the many decades that we need this to last, so we can see how your health changes as an individual and as a group of 1 million diverse people. So what's in it for you is probably in the eye of the beholder. But in addition to giving back to your community, to your country, you're also going to have the opportunity to sometimes know and perhaps even predict many aspects of your own health. Now, I want you to know, should you decide to volunteer, you will be joining an amazing and exciting startup of dedicated, compassionate people from all across the country. These 7 sites today and 45 others who we're putting on local events are testament to that fact. The group of now over 100 health provider, academic, community, and corporate partners, we all met for the first time on July 6, 2016. We're not even 2 years old yet. We met back then, we broke bread together, and we got to work. And in record time, we got input from potential participants from diverse communities around the country. We developed this initial research protocol that many of you are starting today. Many of you have told me about that here on this field in lovely Detroit. We built the internet sites and the phone apps you're using to even watch this. We created a secure big data repository, and we opened over 125 enrollment clinics around the country. We developed a call center to be able to answer questions in both English and Spanish, and we constructed a biobank to safely store and freeze your samples coming in from anywhere across the country within 24 hours to the Mayo Clinic. We also, importantly, developed policies and protections to maintain your privacy. Look, if we lose your trust, then we lose the future of science. This is one of the most important things that we focused on. So we have protected the data warehouse where your information is encrypted and stored with the most advanced security available. Thanks to Congress, we have now the ability to use new laws that protect your research data from being used against you at the federal, state, local, or civil level. We've done and will keep doing rigorous security testing. But I want you to understand, we will always be transparent with you. There is no such thing as a 100% guarantee against today's hackers. So we've created procedures and policies to quickly notify you in the event a breach should ever threaten your data or your identity. All of this that we built, we then tested in a beta phase where tens of thousands of you who signed up, shared your data and consent, and gave us feedback to improve the experience for everybody else joining today's national launch. And I want to thank all of you who persisted and were patient with our early systems. But we are just at the beginning of an amazing journey. In the coming months, we're going to work with participants to pilot some new features, and then we'll expand those to everybody. More interactive surveys on new topics that you care about, sharing wearable and fitness device data, collecting more complete health records, because it's really hard to get a thorough record about yourself, using health apps and smartphones, and responsibly sharing your genetic information once we start to do that. We will open more enrollment centers around the country as we see where different people across this great nation have signed up to join this effort, working hard to achieve our fundamental scientific mission. 1 million people who are geographically, demographically, and medically diverse from across this great nation. Now, I have to tell you, when my cancer was finally over, thanks to precision medicine, I received the miracle of a kidney transplant from an amazing coworker. And I'm still foggy from the anesthesia when I woke up from that transplant on the recovery table. And I wanted to just tell my wife, we've got to do this. I want to spend the rest of my days figuring out how to have the precision medicine that I had early access to available to everybody. So it is a dream come true for me. It is the highest honor to lead and build this national treasure. Powered by the volunteerism of 1 million or more people, the impacts of this public resource will not go down only in the medical books, but also, I believe, in the history books. So I hope you'll consider joining, shaping, and growing this startup, this All of Us research program. Let's see what amazing things we can do together to power up the science that can bring improved health and well-being to all of us as unique individuals. Thank you.
We want to thank the National Institutes of Health for those inspirational words. The vision of the All of Us Research Program is clear, and the excitement and hope that we have in the future of research and health is palpable here in Nashville. Now I want to introduce Janet Jernigan, the Executive Director of 50 Forward, and Tennessee State Representative Brenda Gilmore, whose talk is entitled Leaving Legacies and Enhancing Lives. Please welcome the both of them.
Hi, Leland. Good to see you.
Welcome to everyone, and thank you, Leland. And I also want to recognize the elected officials who are here. Many of you heard Mayor David Briley and also Congressman Jim Cooker address the audience earlier in the afternoon. Also want to recognize State Representative Bill Beck and, of course, State Representative Brenda Gilmore, and later we'll hear from Councilwoman Nancy Van Rees. It's great to be here with all of you and with our viewing audience around the country. We're so excited to be part of this worthwhile effort. At 50 Forward, we just are so thrilled to be one of the first 4 All of Us Research Program community partners to assist the National Institutes of Health to educate, promote, and encourage involvement in this exciting new program. As Executive Director of 50 Forward, we are so honored to be involved. We would like to assist the Institutes of Health to build awareness and to also represent the older adult demographic in the All of Us Research Program. Brenda, tell us a bit about your interest in this effort.
Well, thank you, Janet. I'm excited to be here as well. I'm an only child and from a very small family, but as you know, we bring our DNA with us to the table. My mother is from a huge family, and she and all of her siblings died much too early from heart attack and strokes, from diabetes, hypertension, high cholesterol, and I want to do my part in ensuring that my daughter, my granddaughter, and future generations live long, healthy lives. The All of Us Research Program provides important information, important data that will give us a roadmap so that we can have a brighter future. I am definitely all in today.
Well, you mentioned family history, and my father had Parkinson's disease, and I used to really be concerned about what the impact that would be on me and my children and grandchildren. And about 10 years ago, when I participated in the National Senior Olympics in the triathlon, I also was involved with several thousand other older adult athletes.
Congratulations.
In a program associated with Stanford University. And while I learned that I don't carry the marker for Parkinson's disease, I also learned that I do have a slightly greater than average chance of developing macular degeneration or glaucoma. So I'm very interested in the impact of health research on future generations.
Janet, you're right about future generations. I see this program as a way that we can leave a legacy for our young people, for our children and our grandchildren. What a great gift that we can give our children other than the gift of a healthy life. In fact, that's why I'm here today. I'm excited that I've already signed up and the first person in the All of Us Research Program. I'm excited because it can provide some important information to all of us, and I'm honored to be 1 in a million, and I hope and invite others to join me.
That's terrific news, Brenda, and we thank you so much for joining us here today. And we are absolutely proud to have you as our first enrollee. And we invite everyone here in person and also people viewing online to spread the word about this great effort. All of Us Research Program will make a very significant difference in the lives of future generations.
Absolutely.
All right, thank you, Janet, and thank you, Representative Gilmore. Now for our next speaker, I want to introduce Associate Professor of Biomedical Informatics and Associate Professor of Medicine at Vanderbilt University. Please welcome Dr. Josh Denny.
Thank you so much. It's such a pleasure to be here, and I'm so excited for this day to finally be here. After a compressed time and so much work for so many people to have this be a reality, I truly believe all of us is ushering a new foundation of a next generation medical research that will really transform care and leave a legacy of new kinds of research. Dr. Collins mentioned the Framingham Heart Study, which started in 1948 and really dramatically transformed our knowledge, along with other similar research studies with small numbers of people in the thousands about things like heart disease. And because of that, we saw a 60% reduction in cardiovascular disease over the last 50 or 60 years. Just think, these studies could look at only really common disease and used methods where it was very high touch with enrolling and assessing certain variables. And what we've discovered at Vanderbilt as a higher throughput method of using this is starting to use the electronic health record. This has been a powerful method that we have found to accelerate research. We've analyzed about 100,000 individuals between Vanderbilt and our partners across the country, and this is, and we've been able to find that these individuals have up to 30 years of medical history that we can analyze essentially for free by virtue of their healthcare interactions with the system. And by examining these kinds of records, we've been able to discover the genetic links to dozens of diseases and genetic factors which predict drug response, why drugs work in some people and why they don't in others, and why we get adverse events in some. And some of those can be used to improve care for people going forward. And generally, we've been treating all people with the same illness the same way, just like Eric Dishman mentioned in his cancer care. It wasn't until his genetic sequence was found that they actually personalized his care and had the results that led to his improvement in survival from his cancer with dramatic results that he explained. I want to talk about an example of a patient who came into our system. She had her first heart disease in her late 40s. She had a heart attack then, and a stent was placed, and she was started on standard of care. And with that, she ended up having 9 stents placed over 11 months. Her drug didn't work for her, and we know why now. It's because of genetic influence, and we can improve care over time. This is just one example of what we can do with 100,000 patients. Imagine what we can do with 1 million. We can, instead of looking at just common disease, we can look at rare diseases like cystic fibrosis or neurofibromatosis, 2 diseases which has affected my family. We can look at seizures, type 1 diabetes, type 2 diabetes, Alzheimer's, Parkinson's, pediatric illnesses when we start enrolling children over the future, common and rare cancers. This is really why we need all of us. The 1 million people will come from every background. Diversity is really important, as everyone has highlighted. The most recent cholesterol drugs that have come on the market were discovered in African ancestry populations. We have discovered certain risks for cancers or why drugs work or don't work in other populations. These discoveries affect all of us. We need every race, gender, lifestyle, geography, rural, urban. These learned things will benefit all of us. One of my jobs is one of the leads of the Data and Research Center at Vanderbilt, partnering with other institutions such as the Broad Institute and Verily, is to collect, organize, and protect the data for the people. We have to make it useful for researchers so researchers across the world can leverage these data and discover new things to benefit all of us. We're building a platform that the best and brightest can use. We want to leverage modern data science techniques that leading computer scientists can leverage. Machine learning and natural language processing, the things that are in vogue in computer science, can apply to health and make health better. Security is job one. We are working with the best of breed security experts internally and externally. Data are encrypted at rest and in transit. We are constantly monitoring the system and testing for vulnerabilities and addressing any potential concerns as we monitor. Researchers will also access data that is de-identified, where we remove the obvious identifiers such as name, address, phone number, those kinds of things, and use data sets that they will access and can do all the research they need to do, but they don't generally need to know identifiers. And this, we believe this program is advancing a vision that will affect not just research, but also healthcare. We want to see healthcare be more patient-centered and be more data-driven. And we're starting this with the participant involvement in programs in all of us. Participants have been involved since the beginning, as you have heard, and continue to be involved in all forms of governance of the program. And we listen to what evidence they give us back. In this way, I think we can improve care for all populations across America and the world, and continue to lead the world in discoveries such as this. So I hope that you will join me, as so many others have mentioned, as part of all of us, and join in this ambitious journey to change healthcare for all of us over decades to come. Thank you very much.
Thank you, Dr. Denny. Next up, we're joined by Angela L. Shine with the National Mental Health, who will be speaking on the topic, 1 in a Million You.
Good afternoon. Back in 1980, Larry Graham recorded a love song called 1 in a Million You. A 1 in a million chance. The sentiment of the song was that the love of one person in a million had impacted his life significantly. Well, in all aspects of life, one person can have a significant impact. That's why I want to talk to you today about the All of Us Research Program. You see, the All of Us Research Program is precision medicine's emerging approach to disease treatment and prevention that considers differences in people's lifestyles, environments, and biological makeup, including their genes. Precision medicine is committed to treat every person as an individual. They want at least 1 million adults across all races, ages, and backgrounds to participate. For years, people of color or folks who weren't part of a certain economic segment were not part of the research that goes into creating treatment. As a result, sometimes we were disproportionately affected by preventable disease. This program will help that become a thing of the past by transforming the way research is done with you, the patient, partnering with researchers and with your provider to stay healthy and manage disease in a way that fits you. After all, everyone wants to be healthier, have the right medications at the right dosage, and get patient-centered, individualized treatment. Our lives, families, and our health situations are unique, so our medicine should not be one size fits all. With all of us, a diverse group of people can participate within the confines of a trusting environment to change the future of medicine for all of us. The National Baptist Convention USA Incorporated, led by our president, Dr. Jerry Young, is excited to be a part of the team to help get the word out about this great program. We believe that health is so important. Look at the times that Jesus healed in the Bible. In Psalms 139:14, the psalmist writes, "I will praise thee, for I am fearfully and wonderfully, marvelously are thy works, and that my soul knoweth right well." So it makes sense that we, as the largest predominantly African-American Christian denomination in the United States, take the lead in helping member congregations and the communities we serve live healthier lives. The Hope Health Ministry of the convention wants you to understand what the program is and how it works. And we want you to visit www.joinallofus.org or www.hopenbc.com and enroll. It only takes a few minutes to simply share some information about yourself, giving precision medicine access to your electronic health records, which, by the way, will all be kept confidential. After your identifying information is removed, The program will use all the data to study why people get sick and what it takes to help people stay well and to make medical strides to make healthcare better, one person at a time. So please take a minute, everyone, to check out the All of Us website or go to our Hope website and click on All of Us to learn more about how you can become a part of this. Please don't be left out. Remember, the program is truly for all of us. Go ahead, be one in a million. Thank you.
All right, thank you, Ms. Shine. And she gave us a few words there, too. So next time, we'll have her sing a little bit more of that song. I loved One in a Million. And you young folks up here going, 1 in a million? Larry Graham, who the heck is that? But, oh, you had great pipes. Oh, great pipes. All right, for our final speaker, we will be joined by Nancy Van Rees, Metro Nashville Council Member for District 8 and Vice President of Business Development at Batch Nashville. Nancy's talk is titled, "We Will Not Be Erased. LGBT participation is vital to all of us."
What a beautiful afternoon here in Nashville and in Madison. Thank you, 50 Forward, for your partnership and participation in All of Us, the research program. I am proud to have this launch here in District 8 at the Madison Station 50 Forward location and the future site of the beautiful roundabout and complete street, Station Boulevard, under construction in just the next few weeks, as well as being the neighbor to the future Madison Town Center that will provide housing, jobs, and a beautiful civic space for our community. Everyone here is somebody different to certain people in your life. You are a mother, you are an uncle, a brother, a sister, a colleague, a friend, a council member, a young person, a senior, or an aging boomer like me. You know all the demographics that you fit into. I'm speaking today as the first out woman elected to a legislative body in the state of Tennessee, and someone who is celebrating 30 years with my wife, Joan, whom I met in a Bible study in Nashville. You don't get more Nashville than that. Members of the LGBT communities are everywhere, demographically diverse, and represent all segments of our society. However, LGBT people are largely invisible in federal population-based efforts because we are not counted. Because sexual orientation and gender identity are not collected during the U.S. Census, the precise number of people living in the U.S., as well as their age, geographic, race, ethnicity, income, and regional distributions are unknown. Without these data, national population-based studies, such as the National Health and Nutrition Examination Survey, are unable to generate sampling frames. This inadequately accounts the disproportionate geographic distribution of resources. In 2010, the NIH commissioned the National Academy of Medicine to study this issue. The Consensus Committee poignantly stated, "The relative lack of population-based data presents the greatest challenge to describing the health status and health-related needs of LGBT people." They went on to emphasize the need for national research efforts to explicitly include data measures. The All of Us research program does just that. We are an underserved and understudied population vulnerable to poor health. A poll conducted by NPR, the Robert Wood Johnson Foundation, and the Harvard T.H. Chan School of Public Health finds that 18% of all LGBTQ Americans refrain from seeing a physician in fear of discrimination. I'll say that again. 18% of all LGBTQ Americans refrain from even seeing a physician because of fear of discrimination. Data collection has slowed under the Trump administration. In the past 15 months, surveys collecting data on participation in Older Americans Act-funded programs and Administration for Community Living-supported disability services have removed questions pertaining to sexual orientation and gender identity. In the same time span, numerous political maneuvers have sown uncertainty and distress throughout the LGBT community. We experience health in a unique and healthcare disparity. We include higher rates of smoking, HIV infection, certain cancers, depression, suicide attempts, and delaying access to healthcare, as mentioned. Infrequent collection of sexual orientation and gender identity data in clinical settings makes performing specific studies very challenging. Healthcare providers receive inadequate training in caring for LGBT patients. It often results in the mistreatment or discrimination, which deters research participation. We need to be included and counted in order to learn more about our community's health and to address health disparities. Now is the time to change the future of health in our community. Please consider participating in the All of Us research program. They've erased us from the census. They've erased us from federal government websites. They've erased us from crime data. And they've erased us from civil rights protections. With the All of Us research program, they cannot erase our DNA. Thank you, NIH, for including literally all of us. Thank you.
What an incredible lineup of speakers. My own understanding about the research program has certainly increased, and I hope yours has too. To be a partner in your own health is an opportunity, and to know that today is only the beginning, the catalyst for positive change in research is inspiring. Thank all of our speakers who came out today, and to learn about All of Us research program is to change the future of health. And thank you to those who have made today's launch possible. The National Institutes of Health All of Us research program, 50 Forward, and Vanderbilt University Medical Center. If you haven't already, please take some time to visit the All of Us Research Interactive booth and the beautiful community art experience, and along with the other vendors who have gathered here today. Visit joinallofus.org, and so I'll mention that again. Visit joinallofus.org to learn more about the research program that aims to change the future of health. Be well, everybody. Go out and enjoy the beautiful sunshine after such a yucky Saturday.